Hi there, Mark Jabin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. Well, it's time for our weekly review. This is being recorded on Sunday evening, so please share this with somebody you care about. So I thought it might be interesting to take a look around the world. This is data from GE Healthcare, and it's the rolling average of new cases per 100,000 population, something we have been following in our weekly updates. If you recall, below 6 is good, below 1 is the goal. So here is Africa, and note that it ranges from a high of 10 in Libya to all the countries in green. Of course, green is good. Mostly that's in the 1 to 2 range. Here you'll see South America, obviously more going on here than in Africa, but Brazil seems to be the hot spot. Argentina seems to be the hot spot. Brazil, which was the hot spot, now down to only about 12.5. So remember that number too. Here in the U.S., you'll notice that red is more than 25 cases per 100,000. And look at Wisconsin, North Dakota, and South Dakota. Do you know the entire states of each of those is red? Later this week, we're going to get into talking about why this is happening. Closer to us, neighbors in our region, particularly note Georgia and Florida. Tennessee, with increasing cases, now back in the red zone. This slide represents the last 7 days of hospitalizations, ICU admits, and deaths. Red is an increase, green is a decrease. So I just want you to note the colors here. This is for across the country. And if you'll note, lots more red than green. I highlighted North Carolina. You'll notice there that cases and hospitalizations are up, deaths down a tad in the state. But not here in Haywood County. Our case fatality rate across the country is around 4%. For Haywood County, it's at 5.8%. What that means is that of every 100 people who get infected, nearly 6 die. Now, our experience has been that this has been in folks in the older population. But the recent deaths here have been people who are older, but who are also living at home on their own before getting sick. So who do you think they got that from? Looking at Haywood County, total cases for the entire pandemic as of Saturday are 646. That's an increase of 20 over the past week, keeping us in the range we have been in really since early August. You'll notice the COVID number remains in the same range as well, perhaps a little uptick at week end to 95. That represents 25 people isolated and 69 in quarantine. Now, that's not yet enough to declare a change in the trend, but as of today, Haywood County has the lowest new case rate per 100,000 in all of North Carolina at 4.6. Congratulations, and thanks to all of you who are doing your part. Let's keep that going, and maybe even more of us will jump on board now. But if we look more broadly across the region, it's a different story. I thought it would be good to look back and compare this week with 6 weeks ago using the same rate of new case, rolling average, 7-day average of new cases per 100,000 population. And please note here a couple things. Pretty busy, but here are the things that I want you to sort of pay attention to. First of all, North Carolina as a state has remained in the red zone throughout. That's the highest risk situation. And if you recall last week, Jackson and Graham counties had such big increases that I wanted to check the data, and the data was correct. So note the increase in counties now in the red, in the upper graph, that's now, versus the lower graph, which was 6 weeks ago, especially to our west, where all are now in the red zone. Second, note the increase between the yellow and the red lines in each graph. Cases are on an increasing trend across western North Carolina. And lastly, remember, 6 is good, below 1 is the goal. Only one county in western North Carolina is below 6. No one is below 1. So that's it for this weekly update. Remember, manage your interactions so you are not in close contact with anyone else, and protect others so they aren't in close contact with you. Avoid being within 6 feet for more than 15 minutes without wearing a face covering. So be concerned about yourself and care about others so we can all live not so much under the shadow of this virus. Be well and be careful, especially right now.